Chat with Dr. Fargo before things get going, so I'm gonna turn that off and wait until it actually like he sits
Okay, because
down.
Megan told me to go live, but I don't know if I can back out of it. That's the problem.
Okay, so move hold the thing for the time being. Yeah, let's do that, and then we're ready.
everyone. It's great to have so many of you here. I'm Dr. Janice Nevin. I'm the President and CEO of ChristianaCare, and it's my pleasure to welcome you here to our wonderful Wilmington campus. So I'm going to start with a little bit of a public service message. We are absolutely dedicated to caring for our neighbors, and safety is a top priority. So for your safety, for the safety of our patients and our caregivers, thank you in advance for adhering to our COVID-19 safety precautions. We require that our visitors, it looks like all of you are doing this, wear an N95, a K95 style mask, or a medical surgical mask at all times, and the chairs are spaced in order to maintain appropriate physical distancing. We certainly don't want anyone to catch COVID while they are here with us. So we'll put that aside, and then I'm so honored to have ChristianaCare's Wilmington campus be the site chosen for signing this important bill that will benefit physicians throughout the state of Delaware. And thrilled to welcome Governor John Carney, State Senator Sarah McBride, who sponsored this legislation. Thank you. Our Chief Wellness Officer, Dr. Heather Farley, whose work was absolutely instrumental in making this bill possible, and Dr. Matt Borday, who's the President of the Medical Society of Delaware. We've also got a few other honored guests here. Thank you for being with us, Health and Social Services Secretary Molly McGarrick. Thank you also, State Senator Kyle Evans-Gay. And of course, thank you, Lieutenant Governor Bethany Hall. It's really great to have you here. This is a very important bill. Senate Bill 300 is a major step forward for improving the mental, emotional, and physical well-being of doctors in Delaware. From the very start of the COVID-19 pandemic, nearly 2.5 years ago, our caregivers here and really across the entire state have faced unprecedented challenges as they met the health needs of our community. And they face suffering at a level they've never had before, and perhaps at a level they never expected to be in their careers. And as we fought this awful disease, we've called them healthcare heroes, and they earned that moniker. But at the same time, it's easy to forget that heroes can hurt. We also need to recognize that they are healthcare humans. And humans are capable of incredible things, but also can face mental, emotional, and physical challenges. And sometimes they need help. And doctors should not have to worry about making a choice between getting that help and endangering their medical license. With this new law, healthcare leaders and government leaders have come together in promoting an idea that has long been at the center of our caregiver well-being work here at ChristianaCare. When we care for ourselves, we are better able to care for patients and each other. It's a strong example of the ongoing partnership between state government and Delaware's health systems, a partnership that has been so vital in responding to COVID-19. I am personally, and we are very grateful for that partnership. And now it's my honor to welcome the man who's led with compassion the state's pandemic response, and who will today sign Senate Bill 300 into law, Governor John Carney.
Thank you very much, Dr. Nevin, and good morning to all of you. It's great to be here at ChristianaCare to finish off the great work done by Senator McBride and her colleagues in the General Assembly. We've been working with them very closely over the last 2 years, and with all our partners across our state to respond to COVID-19 in a way to keep all Delawareans safe. There's no bigger and better partner than the Hospital Association and the hospitals themselves, including ChristianaCare here, and physicians and all the healthcare providers and workers that have responded. We had a really tough go of it at the beginning of this year in January. back in January of 2022, probably the most stressful period over the 2.5 years of COVID-19, and there have been some extremely stressful days. Here at ChristianaCare, as I heard the physician that we had, the head of emergency medical services, we had a group of physicians who came on to our January 11th press conference to express, to record videos, talk about their experience among the physicians in the emergency room and other parts of the hospital, really to get the message out that this is really serious. And but we could do things to help stem the tide and the spread of the virus if folks get vaccinated, wear a mask, get boosted if you're age eligible. You could hear the stress and the anxiety of the physicians who recorded those videos, including the head of emergency medicine here at ChristianaCare. And they pleaded with Delawareans to do the things that they could do individually. And so now it's our opportunity, to the credit of Senator McBride, to step up and to do something for those physicians, to show them that we care, as Dr. Nevin laid out, and that they need to take care of themselves. And so this piece of legislation is an important way of doing that. I want to just take 1 minute to thank Dr. Nevin and her team and hospitals that aren't represented here for their tremendous partnership during the last 2.5 years and ongoing. Our hospitalization rate now is rising a little bit as this virus continues to spread, but they have just been incredible. And it does speak a little bit, or a lot, frankly, about our wonderful state, which is that we are small enough that we can get together, work together, communicate, often disagree and agree, and all the things that go into responding to something that is as serious as this is. And the result is, I think that we're able to be more effective in protecting the people that we all work for and serve. And again, no bigger and better partner than ChristianaCare and the physicians and healthcare providers that work with them. So again, I want to thank the sponsors. I'm delighted to be able to affix my signature to this piece of legislation to finish off their great work. I thank the other physicians for whom this will benefit our hospitals across our state. I should also mention all those who, along with our Lieutenant Governor, reached out into communities, vulnerable communities, to try to get people vaccinated. That tremendous work on the street was so critically important throughout. So thanks again, and I'll turn it over to Dr. Nevin.
I think it's right here. So you're turning it over to Senator McBride.
Thank you, Governor, for that thorough introduction. Good morning, everyone.
Good morning.
It is great to be with you all today, and I want to start with a couple of thank yous. It's always the job of the prime sponsor. I, of course, want to start by thanking ChristianaCare for all of your work, particularly over the last several years, and especially on this legislation. Dr. Nevin, Dr. Farley, Bettina, Meredith, so many folks on their teams who helped make this bill possible. Thank you so much for your work. Let's give them a round of applause. I was also proud to join with the Medical Society of Delaware and the Delaware Healthcare Association, who do so much in support of physicians, providers writ large, and patients, including with their support and work on this legislation. Of course, we would not be here today without my colleagues in the General Assembly, including the bipartisan coalition of legislators who sponsored this bill, and all 62 members of the Delaware General Assembly who voted for it. I especially want to thank the House Prime Sponsor, Representative David Bentz, who unfortunately could not be here today, and I know it pains both me and the governor, but we're going to have to get used to his absence because he is retiring, which doesn't feel like the right word since he's so young, from the General Assembly at the end of his term. I'm also thrilled that my colleague, Senator Gay, is here. She's a partner in change with me in the Delaware State Senate, and is just an absolutely wonderful colleague to work with. Of course, our Lieutenant Governor, who as a nurse understands firsthand the importance of empowering and supporting all those who work in healthcare. And finally, a huge thank you to our state's great governor, John Carney. It is always a privilege and a pleasure working with him and his incredible team, including the folks from the Department of Health and Social Services and the Division of Professional Regulation who work on this legislation. You know, as I'm standing here, I am thinking about one of my favorite quotes from Mr. Rogers. And as the baby of the Delaware State Senate, I'm allowed to quote Mr. Rogers. When he said that when he used to see something scary on the news, his mother would tell him to keep watching and to look for the helpers. And it's a quote that's been on my mind a lot over the last few years as we witnessed so many go above and beyond, provide critical support through a once-in-a-century, God willing, crisis. Frontline workers, public health officials, volunteers in their neighborhoods, and of course, healthcare providers who summon skill and perseverance and courage to meet this moment. And so today it's a privilege to stand with you and beside you as Senate Bill 300 is signed into law. It is important, as the governor mentioned, that we honor your role and your service in the state. Not just with awards, not just with recognition, but with actions that better support our providers in both their professional and their personal lives. Today, as Dr. Nevin mentioned, is about facing head-on what we so often struggle with as a society. The recognition that the helpers are also human, that to care for one another, we all have to be able to care for ourselves, and that, of course, mental health care is health care. In any year, the work of the folks who work in this building and around the state within healthcare is hard, physically, emotionally, intellectually, and personally. But that has never been truer than in the last few years. I don't have to tell folks in this room that provider burnout is at an all-time high. And it's contributing to a provider shortage that both exacerbates the toll on those who remain and diminishes the access to care for those who rely on you. Unfortunately, despite good intentions when they were passed, components of Delaware's physician licensure and reporting policies were, in a word, draconian. While all our providers are experiencing burnout, these physician-related policies created heightened barriers to care and reinforced harmful stereotypes, a reality that diminishes rather than fosters patient safety. So Senate Bill 300 seeks to reform those policies by codifying that getting care, whether physical or mental, is not in and of itself a reportable event. We make clear that physicians can practice when they get care and have a condition successfully treated, creating an incentive rather than a disincentive to getting care and getting it early. Sweeping mental health needs under the rug, pretending that our healthcare providers aren't people with the same healthcare needs as everyone else, doesn't help anyone. Indeed, it only puts our providers and our patients more at risk. And today we change that. Today we open up pathways to care for our caregivers. We modernize our laws to reflect best practices, we improve patient safety, we combat stigma, and we demonstrate that simply needing mental health care won't be and shouldn't be a limit on someone's ability to pursue their dreams and reach their highest potential. So thank you all very much for being here. It is now my pleasure to introduce the Chief Wellness Officer here at ChristianaCare, Dr. Heather Farley.
Wow, I'm going a bit off script here. My external affairs colleagues are about to hold their breath, but this is a day that I had hoped we would be at for over 5 years, and so I do not believe that this is actually happening. So today is the culmination. Oh, let me take this off. Today is the culmination of so much good work with such incredible partners. So of course, I want to thank Governor Carney, Senator McBride, Representative Benz, and all of the co-sponsors of this critical legislation, which passed both chambers unanimously. I also want to thank Dr. Nevin and the leadership team at ChristianaCare, who have been so supportive of our caregivers and our well-being throughout the pandemic and before. Finally, I want to thank the incredible team I worked with to develop and support this legislation through the process. Dr. Mo Loeffler, Dr. Vishesh Agrawal, Drs. Katie Godfrey and Mark Nason, and the entire ChristianaCare Center for Work-Life Wellbeing team. Dr. Burdett and the Medical Society of Delaware, the Delaware Healthcare Association, and especially Meredith Tweedy and the ChristianaCare Government Affairs team. As Senator McBride mentioned, we know that physician burnout is at an all-time high. And we know that physicians have higher rates of depression and suicide than the general population. Despite those higher risks, physicians are oftentimes much less likely to seek treatment, to seek mental health support, and that can often be due to those broad questions about mental health history or its hypothetical effect on their competency that often are asked by state medical licensing boards. Indeed, prior to this bill, as Senator McBride mentioned, Delaware licensed healthcare providers had a mandatory duty to report Delaware licensed medical practitioners under certain circumstances, which included mental illness. At the federal level, the Dr. Lorna Breen Healthcare Provider Protection Act was signed in March of this year. That bill aims to reduce and prevent suicide, burnout, and mental and behavioral health conditions among healthcare professionals. It was named in honor of Dr. Lorna Breen. She is a New York City physician, an emergency physician, who died by suicide during the initial wave of COVID-19. And here in Delaware, the law that the governor will sign today will make it clear that a physician's ability to practice medicine is not impaired or prevented by a mental or physical disability when the condition is being treated appropriately. It removes the mandatory reporting of a physician for reasons of mental illness or physical illness, such as aging and drug or alcohol use, while leaving all other reporting in place and maintaining patient safety. Ultimately, this law supports the well-being of our caregivers and ensures that physicians can get the help that they need. Now we know that it really is okay to not be okay, and we're demonstrating that we will care for our caregivers here in Delaware. Now I'm happy to introduce the President of the Medical Society of Delaware, Dr. Matthew Burdett.
Good morning, everyone. This is a really special day. It's frankly an honor to be here today, and I initially also want to give thanks to folks up here, the Governor Carney, Dr. Nevin, Dr. Farley. I would also specifically like to point out Senator McBride and all of your help and those legislators. I mean, it's a major day for our physicians. And also, I just want to thank Dr. Rich Henderson, Chair of the Government Affairs Committee at the Medical Society, for all of his support. So this is a fantastic day. You know, it's also a relief. It's a relief for physicians who have struggled with tension, depression, anxiety, insomnia, lack of nutrition, and many other things. This bill is a major step forward, however, in having physicians realize that, hey, there is help for you, you can get it, you need it. I just can't tell you enough how much of a relief it is. I would say this, though, it's a new phase for physicians to think about that. You know, physicians in general signed up for a business where there's not a lot of thanks in terms of, you know, being well. I mean, we sort of just go with the territory of lack of sleep and, you know, thinking about patients indefinitely. It's not a 9-to-5 job, but it's going to take a little time, I think, for physicians to really get used to the fact that, hey, you need help. You're not well. You can't take care of patients well if you're not feeling well. So it's extraordinarily important, I think, to have physicians recognize that. So there will be an education component that's going to be clearly very important about that. And you know that since the days of Hippocrates, medicine has changed quite a bit. I think many of us realize that we have various burdens that didn't exist in those days of Hippocrates. We have issues regarding the electronic medical record and its burdens, the issues of Medicare reimbursement and issues with that, prior authorization, long hours that continue, and the pandemic certainly hasn't helped, and in fact has brought much of this to the forefront. So doctors are burned out, and as Dr. Farley mentioned, that's been an ongoing problem even before the pandemic. But just to point out the fact that burnout is a psychological condition. It's something that I think we throw around a lot, you know, that people may be burned out, but really it has psychological impact. People are exhausted emotionally and diminished in their personal achievements, and when they're feeling like that as a physician, you really can't take good care of your patients. So we really do need to realize that taking care of patients is important, obviously, but we have to be well enough to do that. And it's still problematic even in medical students and residents and newly minted physicians that depression, anxiety, and as Dr. Farley mentioned, the suicide rate continues to be at an all-time high of 400 physicians per year. That's got to change. I mean, it's just incredibly horrific that that still exists. So just to finish up here, I just want to also make some comments about the issue of burnout and why physicians need help. It's associated with unhealthy behaviors. There's an increased incidence of alcohol use among physicians and drug use, absenteeism, early retirement, and lack of empathy goes with the territory. So clearly it's time for a change. I'm so glad that this bill has been passed and will be signed by the governor now, and thank you all for being here today. Thanks.
This says, Governor signs bill.
I think I can handle that. Well, at least we have bill signings in person this year. It really is a privilege for a governor to be able to really finish off work of legislators, work of members of the community. You heard from the partners involved in this, in terms of the physicians, the ChristianaCare, the Hospital Association, and how important this legislation is. But it really takes somebody from the General Assembly, Senator McBride in this case, to pick up the ball and run with it. It's not often that we have bills that pass unanimously in both the Senate and the House, maybe more rare these days than before, and so it speaks well of Senator McBride's efforts of the partnership with the advocates around this very cool piece of legislation. So it's my privilege to finish off that great work and to put this in place to help. Good stuff. Congratulations, Bill.